So this is a short video on the assessment of color vision. I mentioned that if someone has a cataract, for example, their ability to see clearly might change, but they still should know what red looks like and what green looks like. That should not change. If someone has an optic neuropathy, on the other hand, their whole ability of how they perceive colors does often change, and it's important to detect this. So in the clinic, one of the most sensitive common ways of checking for color vision is using something called the Ishihara book. And it's a book that has a series of pictures in it that are mainly of numbers. And you simply show the picture to the patient and ask them to identify the number, and then you turn the page and move on to the next number. So obviously, some patients might have trouble seeing numbers. If it's a child, for example, what do we do if the child's not able to tell us what the numbers are? There are plates where you can simply ask the child to just trace the path. I could give the child a pen with the cap on it and tell them to trace the path here and verify that they're able to distinguish where the colors are. What do you do if there's a patient, if you're doing the Ishihara test, let's say a patient comes in who has very, very poor vision. They have a horrible cataract that leaves them with very, very blurry vision, and they're not able to recognize any of the numbers. Does that mean that they have a color vision issue? Maybe it's just that they don't succeed because they can't see any of the numbers of that size. So for that purpose, we start off the test often by asking the patient to read a control plate that has the numbers of the size that will be used. And if they can't read the control plate, then we know that using the test is not worthwhile proceeding because of that limitation. And in fact, what I'm showing you here is the control plates, and I'll get into why I'm showing you the control plates later in this presentation. So that's the Ishihara method, and that's the default method that I would use to test color vision in the clinic. Another method that is sometimes used is the Farnsworth D15 panel, where, as you can see within this set here, there's colors ranging from the blues to the pinks, and these discs would be randomly presented to the patient. They would all be laid out on a table in a random order, and the patient would be asked to sort them from the most blue to the most pink. And this gives us another effective way to look at the color. Sometimes, for example, in patients where I feel that they are not able to do the Ishihara test that I showed you previously for various reasons, checking the Farnsworth D15 can be an effective alternative. Now, if you're a medical student, you don't have access to the Ishihara book or the Farnsworth D15, how can you check color vision? Well, you certainly can check it in a good way just by taking a red object. So one of the specific ways that color vision changes when someone has an optic neuropathy is that their ability specifically to appreciate the color red changes. You could take a pen, for example, and present it, have the patient close each eye and look at the color of the red pen, and you'd be asking them whether the color itself seems to change. Does it become, for example, more pink, less intense when they look at it with the eye that you're concerned about? And if the patient clearly tells you that it looks like a more faint color when they're looking at it with the eye that you're concerned about, then we would call this red desaturation, and that would be a suggestive sign that they might have an optic neuropathy. The reason I showed you the control plate was because, as many of you will be aware, there is, in very normal, healthy male individuals, a phenomena of color vision deficiency that occurs in perhaps 5% of the male population. And so every so often I'm testing a male and I bring out the Ishihara book and they're not able to see anything at all. And this is just something that's taken into context. And when that happens, If it's clear that they, in both eyes, are not able to appreciate the colors, then looking at contrast vision, which will be the next topic I'll get into, can be a helpful alternative.